Good afternoon. I'm Rita Hamad, an Associate Professor of Social and Behavioral Sciences and Director of the Social Policies for Health Equity Research Center here at the Harvard T.H. Chan School of Public Health. I'm pleased to be joined today by Abhijit Banerjee, the Ford Foundation International Professor of Economics at the Massachusetts Institute of Technology and co-director of the Abdul Latif Jameel Poverty Action Lab. Through his work at the Poverty Action Lab, Banerjee has developed an evidence-based economics approach for fighting poverty. He was awarded the 2019 Nobel Prize for Economics alongside his wife, economist Esther Duflo, and economist Michael Kremer for their science-based approach to fighting poverty. Thank you so much for being here today.
Thank you.
So jumping right into our questions, in your book, Poor Economics, you said that policies to address poverty so often fail because of an inadequate understanding of poverty. What are some of the biggest misconceptions about poverty, and what do you wish more people understood?
That's sort of the text of that whole book. So I'm going to summarize. Let me give an example. I think one of the things that often comes up is, people will say, I saw this person and she was so poor and she had a cell phone. And somehow the implication there is either that she's probably not that poor, or that there must be something perverse about this behavior. And I think one of the recurrent themes of poor economics is that there's nothing strange about this. These people are very poor. They, for example, will buy the cheapest phone. They won't use it unless there is a particular reason to use it. But the fact that even very poor people don't spend their entire income on whatever food is entirely part of the distinction between sort of surviving and living. That is, it's true that you'll have to eat a certain amount to survive, but I think at the margin they often will think, look, I still need to be able to get through the day. It needs to be a little bit more pleasant than just I ate 3 very bland meals which gave me the adequate amount of calories. So it has to be something richer and more interesting than that. Otherwise life isn't worth living. And I think most people will find ways to, make their life a little bit less drab. And that involves, sometimes it means I have a phone so I can talk to my brother, and that's one thing that makes my life better. Or I have a television, and it's the one thing I have, and I can, at the end of the day, sit down and see a soccer match. We met this guy in Morocco who was, and it's in the book. He was complaining almost for like 20 minutes about how he would like to eat more and how he didn't have enough food. And then we go into his house and there's a television. And we asked him, well, you have a television? And he said, well, Lord, television is more important than food. Why? Because otherwise life is, especially in these relatively remote areas where there are very few people, what else do you do? What's there to? So in the evenings, sometimes he gets together with his friends and watches a soccer match, and that's the high point. So I think that's one misconception that I think is particularly, I think, salient, because it often turns into a judgment.
According to the UBS Wealth Report for 2023, the wealthiest 1% hold nearly half of the world's wealth, and 40% of the global population holds less than 1% of the world's wealth. So in other words, it's not a matter of how much money, but about allocation of money. So the question then is, should wealth be redistributed, and if so, how?
The part that should it be redistributed is not that interesting. I think the answer is absolutely yes. I think there's no credible arguments on the other side, I would say, in terms of should it be, because I think there's this kind of slightly mythical view that if you have to have the inequality because, otherwise the rich will stop working. You read Elon Musk's biography, and one thing you can see is he's a totally obsessive man. If you told him you have to stop working for the next 6 months, he will, shoot you or something. There's just no way he could do it. He's obsessive about doing things. So it's the idea that he needs the 54 or 56 billion dollars he demanded to keep working. That's what he said. In fact, is just plain false. He couldn't stop working if he tried. So I think that the idea that you need for this much inequality for incentives is I think every piece of evidence we have. Rich people respond to tax rates not by reducing when the tax rates go up, they do something. What do? They don't stop working. They look for tax havens. That's the one very good reason to coming back to the rest of your question. I think the first thing we need to do is stop the tax havens. I think it's extraordinary to me that we sort of live in a world where countries exist in order to give a bunch of people the excuse of not paying taxes. The whole country's, that's the, raison d'etre. And that seems to me to be, unacceptable is too weak a word. It's awful. And we should have a global, there is a little bit of movement there, this idea of a 15% minimum corporate tax wherever you look at it. So it's a bit of a, this is sort of responding to the Ireland problem, that, Ireland has a huge GDP per capita. Why? Because a lot of companies book their profits in Ireland. Why do they book their profits in Ireland? Because Ireland guarantees people low taxes. This I think needs to be solved.
So drilling down a little bit into other policies to address poverty, another policy that's gaining a lot of interest in the US and worldwide is universal basic income. You published a study on universal basic income in Kenya. What was the impact of cash transfers to the poor?
So let me give you the longer answer. I think we have a little bit of time. So part of what we're trying to do is look at the effect of guaranteeing people basically something of the order of a little bit less than $1 a day at purchasing power parity every day, and look at what happens to their lives. What do they do? Part of the other goal of the study was to look at whether or not other similar programs, but cheaper ones, could have comparable impacts. So there were two other programs we also studied. It's a randomized controlled trial covering 200 villages. So there were 42 villages where everybody got this amount of money for guarantee of 12 years, and every adult and actually every 16-year-old was told that once you reach 18 you are entitled to it. Then there was what we call the lump sum intervention, which is when people were, instead of being given the money in dribs and drabs every month, they were given one lump sum, not equivalent to 12 years of the money, but equivalent to 2 years of the money. And the third intervention was to give them just 2 years of the money, but then every month. And what's striking, there are three things that are worth saying. One is that the usual, I think often very ideologically loaded question that you get, and most universal basic income and other programs deal with, is the idea that, well, you're giving people easy money, aren't they going to become lazy? And I think what is striking is there is, if anything, an increase in the hours worked in all three of these versions. There's no evidence that hours work goes down. The second thing you see in all of them is a switch away from working for a wage and towards doing something on their own, towards self-employment. That's bigger. So that one's smaller when you give them 2 years of money that comes every month. If you give them, it's biggest if you give them a lump sum. They immediately start something, usually a shop or a service business, delivering or something, and then for the universal basic income, what we will call the long term, it's in the middle. So, but again, it's always a movement towards working for yourself, starting businesses, and then the usual. Not unsurprisingly, people eat better and eat more. They eat more calories, at least. They spend more on education. Surprisingly, they don't spend more on healthcare, partly because they visit doctors less, and that might well be that they are less depressed. When we look at mental health, all three interventions improve mental health, various measures of mental health, all the way from depression to locus of control measures and all of those. And the long-term intervention in particular, all of them have a effect on gender-based violence. The long-term intervention, the lump sum intervention has the biggest effect on gender-based violence. So many pieces of good news. What is harder to tell, because our data is from when exactly 2 years have passed, so that we can sort of see the end of the 1 2-year program, the other one that's supposed to be the same money for the 2 years, and the third one that's keeps going, and we see that at that point we see these differences. That it's not to say that things won't change after this. It's clear that, for example, the people who were getting the money that's about to run out are really very conscious of that. They're buying durables like there's no tomorrow. They're the ones who are trying to put all the money into things that will last. So they're repairing their roofs, they're buying furniture, they're buying household durables of different kinds. And so there is a clear sense in which they are conscious of that date. And in some ways, I think they're also less likely to invest than the people who have a long term, even though this is at 2 years. So they all three of them got the same amount of money, and the long term and the short term got exactly the same amount of money. They were getting monthly payments, but they behave very differently. They're much less likely to start a business, because I think they think that it's not just a matter of starting the business, it's a matter of sustaining the business. And if your money is going to run out, you may not be able to sustain your business. So they are less likely to start a kind of a non-agricultural business. They invest it in improving their agriculture. They invest it in repairing their homes, etc. And of course, what could happen afterwards is that as the money runs out, maybe they will regress back to where they started, while the other one will continue. We don't know any of what will happen. Is it a one-time intervention that has a durable effect? We have some evidence from a very different intervention that durable effects are possible. So we have an intervention where a family was given an asset, and we've tracked them for 10 years, and 10 years later they're still 25% richer than the people who didn't get the asset. So it's possible that long-term durable effects could happen, but we don't know that. We can't tell that without going back to the data. We probably will go back to the data in the next 1 or 2 years. But that's the long answer to your question.
Yeah. Well, I look forward to seeing those results when they're ready. So another policy question about these cash transfers is whether they should be conditional or unconditional. Can you speak a little bit about how effective those two versions are and what the trade-offs are?
So the trade-off is, if you have a particularly clear, two reasons to make it conditional. One is political. I think it's very clear that the same people who think that money will make people lazy are happy if you say that, and this is going to make them vaccinate their children. So there was in Mexico and in Latin America, it was very clear that the political objectives were important, that it was a gesture towards the middle classes who were suspicious of giving money to the poor. Then there's a question of is there a reason to act? Suppose the political objectives were not there. Is there a reason to have conditionality? And on one side, it's expensive to be conditional. To enforce conditionality is, you have to check things. You have to actually deny people money. You have to sort of be there to enforce it, and all of that's expensive. On the other side, you do see there are randomized control trials which compare the effects of, for example, conditionality on education of the children versus not, and you do see bigger effects on education from enforcing the conditionality. It's not clear to me that I can directly say that therefore enforcing it, having conditionality and enforcing is better, because enforcing is not free. It both excludes people, especially people who are often the most vulnerable, because for them it's hardest to make sure that if you're out collecting garbage from 4 a.m., are you making sure your child is going to school? Of course, there is both that and a concern about whether or not the conditionality is, who's going to go check it and how accurately and all those things. So I'm not entirely sold on conditionality, but the trade-off is, I think, now being extensively studied.
Mm-hmm. Mm-hmm. So pivoting a little bit from cash transfers, another form of social welfare is nutrition assistance. Can you describe some of the most effective ways to provide food assistance to vulnerable populations? And then what are the trade-offs between providing assistance as food versus providing it as cash transfers?
So the first order fact in most places is there's no trade-off. You see no advantage to providing food. We have a study in Indonesia where we replace the government replaces food assistance, rice that gets, you go collect your bag of rice, by people get a card which allows them to go buy rice or eggs, and you see nutrition. Overall, the extent of rice transfers is exactly the same, but poverty goes down by 20%. Why? Because when the rice comes in big bags and has to be divided, some of it leaks out. When it's you going and collecting your own rice, there's no leakage, and so you see a very substantial reduction in poverty. So first order, in most places, there are many randomized control trials which compare, getting food versus getting cash, and unsurprisingly, there is no effect, because the fact that you get food, it's not that you're not buying some more food at the margin. So if I give you the food, it's not that you get so much food that you don't need to buy any. So therefore, the choice is always, if they give me some food, do I buy the extra food or not? And otherwise, do I buy the whole thing? So it really shouldn't make a big difference. And the evidence is very clear, it doesn't make a difference. Where does it make a difference? It makes a difference where the market for food supplies doesn't function. So in rural Niger, which is extremely low density, basically this is the edge of the Sahara. very low density and very hard. The food supply chain is very weak. And there, the fact that the government is bringing the food to the village changes the supply situation. Where the market is relatively well developed, there is no evidence. That's, you know, in lots of countries. This was especially the Inter-American Development Bank did a whole bunch of studies on this in different Latin American countries and found convincingly that it made no difference.
Mm-hmm. So a lot of the work that you do has implications for actual policy making, and many of us do research or work in poverty policy because we want to have that translational impact. So what are the different ways that your research has translated into policy change, and how do you get that political buy-in?
Okay, so I mean, I'm going to speak in the for the collective, not my research, but I think our organization's research, because I think that, and I think that partly the reason why we set up an organization was exactly for that purpose. Because I think one thing that we learned very quickly was that it's not enough to say we have a great result, it's published in the American Economic Review, look it up. That's not how the world works. So what you have to do in all of these cases is have several layers of persuasion that sit on top of the evidence. The evidence is essential, because otherwise you could do something that's no reason to be done. But once you have the evidence, you still need the bandwidth to take it to the next layer. So the next layer is sort of publicize it, find a place often in the media for the result. And the media is often difficult because if it's a kind of it has to be pretty exciting for them to get excited, so you have to fight that battle. And you have to persuade policymakers that they should, pay attention to this, because from where they're looking at, there's always, and I'll say this, and you should take it as my particular prejudice, there are always consultants available to give you any answer you want, often for the right price. So if you want a particular answer, you just pay a consultant. So we're constantly in a running battle with, not directly, but sort of in parallel with the consultants who are always coming in saying, why bother listen to this complicated evidence that was generated over 3 years? I'll tell you the answer, we know it. And so you're always in that world where you're joining these conversations with a lot of people who come, bearing snake oil, and you're, and all the big names are bearing snake oil. McKinsey and Boston, BCG and Bain are all snake oil salesmen. And you have to somehow deal with the fact that they will come and offer easy options that are not particular. So there are many conversations, and there the fact that you have evidence from a randomized control trial and somebody else has evidence from hearsay is not per se definite. It's not decisive. At that point, people will, because from the point of view of the government official, he's very busy, he has a day job, he's doing 50 things, and then you're telling him this, and he has to pay attention and listen to the nature of the evidence. So some of our biggest success have been just somebody who just happened to be at Harvard, for example. There was many years ago a person who would eventually be the head of the Gujarat Pollution Control Board in India was, I think, an MPA student at Harvard. And he met somebody, a professor there who was a part of our JPAL, and that's how a series of projects started. And because he was there, he was sort of had the time to listen to this, and he was convinced. And so we've since then had, I wasn't involved, but series of projects going on for now 15 years with the Gujarat Pollution Control Board. Right now I think they are working on trying to create a trading market for pollution permits in Ahmedabad, after they showed that in Surat that reduced pollution by 20%. So it's very much this kind of, you have to have somehow somebody's ear for a little while, but even that's not enough. Typically, that's a good first step. But then even then, there's always the guy who you've convinced, who wants to do it, who's all prepared to do it, still has a day job. He has many things to do. So it's often some piece of innovation which will require pushing people out of their comfort zone and getting them to do something different. That's always second priority. So one other thing we have often done is we have basically hired someone, usually a relatively young person, to go and work in the office of that person, to be a kind of a voice for the research, to say, well, sir, can we get this through this step? Can it get signed by this person? And you do that for a while, and it takes all of those steps. Sometimes you get lucky and it happens very fast. Sometimes it takes a couple of years of very patient, pen pushing to get there. But it's the only way to do it, is to be mindful of the structure of the implementation.
Mm-hmm. Yeah, thank you. Those are amazing insights into how to actually get the policy impact. So we have one final question before we wrap up. What gives you hope for the future?
I mean, it's easy to despair, but if you look at just the period from 2000 to 2019, it's a period that's actually remarkably positive for the world's poorest in so many ways. Poverty goes down massively, and not just in like China or India. It goes down everywhere. Infant mortality goes down massively. Maternal mortality goes down massively. Malaria deaths, for example, go down massively. So there's just a series of very positive things that happen. This is a period where, if you looked at it from the point of view of the world's poorest, it's a very positive period. So that's probably this. Given that this was in general seen as being, there was the 2008-9 crisis, etc. It was not seen as a particularly positive period. But if you look at the data that we look at often, it was actually a very good time. The pandemic was a disaster. That's clear, and countries have only begun to catch up, and some countries haven't. But it was before that there was actually a sustained, 19 years of pretty good progress.
Mm-hmm. Yeah. And hopefully we can get back to that thanks to work like yours. Unfortunately, that's all the time we have today. Thank you so much for this insightful conversation. If you missed any part of this program and would like to watch it again, a recording will be available on the Harvard T.H. Chan YouTube page. Have a great afternoon.
Thank you.